we also need to be putting a lot of money into healthcare. We need to make sure that everybody in America has access to quality, affordable healthcare. And I don't think we do that by forcing everyone onto a government one-size-fits-all program designed in 1963. Medicare is great. Medicare can be better. And it should be an option that Americans have, but it shouldn't be the only way to go.
So let me ask you about that. You get your healthcare from the VA, which is a single payer system. You said, sort of the day you announced that it leaves a lot to be desired. What is the problem day to day in terms of that single payer care that you receive?
Well, maybe it's best illustrated by a story.
Sure.
So I was lifting and got a hernia.
Okay.
Right before I was sworn in as a member of Congress, and so I was like, okay, well, I made this commitment. Got to put it to the test, and so I was moving down to D.C. I went to the Washington D.C. VA, which is I usually go to the VA up in Boston, but I went to the D.C. VA, gave them my name, social security number to check in, and they said that after 20 minutes, they said, well, we don't have any record of you. We can't prove that you're a veteran, so we'll consider taking you as a humanitarian case.
What? Why?
I mean, I wanted to say, well, I just won the selection. Like, maybe you can Google me, but I was not playing the congressman's card.
Right.
That's not why I was there. So I just sat down in the waiting room next to a fellow veteran. He'd served in Vietnam, who said, I've been waiting here for 5 hours just to see someone. Now, fast forward a day or two later, I got my surgery. Great surgeon, was working there because she believed in vets, wanted to help them. She was normally worked at GW, but she did time at the VA hospital. She did a great job, but as they were putting me under anesthesia, she said, "Yeah, I don't trust half the people who work here."
What?
And I was like, "Whoa, time out. Maybe we should stop
timing,
here,
yeah.
right?" But before I knew it, I was out. And woke up that afternoon.
That's why my left arm's attached to my right now. That's a horrible thing to say.
Yeah, didn't exactly give me a lot of confidence.
So, okay.
But here's the best part.
Okay.
I woke up and went back to Capitol Hill with my little baggie of medicines. And they said, when the anesthesia wears off, this is going to hurt a lot. So they gave me some powerful painkillers. They said, you can try taking one. You probably need two. I didn't take any when I got back to Capitol Hill because we had votes that afternoon. So I wanted to remember how I voted. But then it was really starting to hurt. And so I took a pill. Like a half hour later, I'm in this meeting. I'm like, geez, this is killing me. So I went back to take a second pill. And I looked more carefully at the bottle, and they sent me home with the wrong medication. They sent me home with Advil.
So that story is insane. And everyone who treated you should be fired, except for the surgeon. Do you think that's, unfortunately, infuriatingly, despite many pledges to fix it, the VA is historically fucked up. And Obama committed to doing it. We weren't able to achieve it. There's a lot of extenuating circumstances. I'm not making excuses, but it's a notoriously mismanaged organization. Do you think that your challenge is unique to the VA, or do you think that it's a real parable for a broader single payer system?
Well, I'm afraid it might be a parable for a broader single payer system. Because it's the only single payer system that we really have in America, and despite constant pledges to fix it, it hasn't been fixed.
Yeah.
And that's why I think that actually tapping into the age-old American system of a little bit of free market competition would be good for healthcare. Not to the extent that it is now, where insurance companies run rampant, and a lot of people are priced out of healthcare, but healthy competition between a public option, between a single payer option and private payer systems, or private payer options. And that means you're not going to kick people off their private healthcare if they like it, but it also means that those private healthcare plans are going to have to compete with the public option. And that makes everybody better. Competition makes everybody better. There are also some things the VA does really well, and I think it's important to acknowledge that too. Not just that surgeon, but they negotiate drug prices. Medicare doesn't do that. That's actually one of the big problems with Medicare. Mm-hmm. They do not negotiate drug prices. The VA does. It's a great prescription system. If I had a medicine and I needed a refill, I could just go online, check the box. It shows up in the mail 2 days later. It's brilliant. There's no reason why we shouldn't do that throughout our entire healthcare system. Yeah. But the point is that if you just force everybody onto Medicare, I don't think everybody's gonna be too thrilled.